Hey, so today we are going to talk about some dermatological drugs for skin conditions. So let's get started. So firstly, let's define the skin. Well, the skin is actually the largest organ and the body's protective barrier. So not too many people think of the skin as an organ, but it is in fact larger than the lungs, larger than the heart, larger than the brain, larger than the liver, any other organ in the body. It is the largest organ. Now, it's also known as the integumentary system. Now, the integument is not just the skin, but also hair, skin, nails, any body covering. That all makes up the integument. Now, dermatological refers to a drug used to treat a condition or disease related to the skin. And these are varied conditions. They can be, they have a wide diversity of potential etiologies and potential problems. So because the skin is a protective barrier, when it's compromised, it can be compromised by a number of conditions. So we have trauma, which is what you think of probably right away, which is burns, cuts, abrasions, bruises, any sort of damage to the skin. Also fluid accumulation, so edema, cellulitis, blisters, discoloration, which is also quite common. That's rashes, freckles, any drug or allergy related photosensitivity. You'll see a lot of times in these videos, I'll talk about photosensitivity of certain drugs. You have to use very specific, or I shouldn't say, you should use different types of sunscreens and certain precautions when you're using certain drugs to prevent photosensitivity, especially if you have to be outside. We also have what's called hyper or hypomelination of the skin, which is just a fancy way of saying that the skin pigment can change. So that's like vitiligo, for instance, and some other diseases or disorders. Dry skin and scaling are very, very common. That includes dandruff. Cancers as well, unfortunately too common. That's basal cell, squamous cell, or melanoma. So those skin cancers are very, very dangerous. We also have non-malignant, non-cancerous growths in the skin. So those are like keratoses and like skin tags, things like that. And we also have your run-of-the-mill skin conditions that might be related to an overactive inflammatory or immune system response. And that includes eczema, psoriasis, acne, and other conditions. Now, flashback to your time spent compounding. I'll just give a quick overview of some common dermatological dosage forms. We have our creams, which are, of course, emulsions of oil and water that's thicker than a lotion and maintains its shape when removed from the container. So that's how you tell the difference between a cream and a lotion. We also have foam, which is dispersed media formed by trapping pockets of gas in solids or liquids. So technically, it's like a gas emulsion. Now, we also have gels, which are a liquid that's thicker than a solution. Lotions, which are an emulsion of oil and water that's thicker than a solution as well. And then we have ointments, which are viscous, semi-solid, greasy mixtures. So they're usually not prepared with water. It's more so oils. And also topical solutions, which are low viscosity liquids that usually contain water or alcohol. Now, for any dermatological product, if you remember nothing from this lecture, remember this. It is for external use only if it is atopical. Topical products are for external use only. Also, wash hands before and after use of topical products. That's a no-brainer, right? Because if you are applying a topical product without gloves on and you accidentally touch your face, touch your mouth, blow your nose, something like that, you get that into a mucous membrane, that can cause some complications. So wear gloves, especially if you are, say, applying a dermatological topical medication that is not to you, but say maybe you're a caregiver and you're applying it to somebody else, make sure that you're not going to be affected by that absorption, because those drugs are meant to be absorbed through the skin. You shouldn't have them on your unexposed hands if they're not supposed to be. Now, also, many dermatological products should not be applied to tender skin areas such as the eyelids, eyes, nose, or mouth. They can cause some irritation and you can get some significant problems with that. Now, the first of the dermatological products we're going to go to are hydrocortisone or Cortef. Now, it's a steroid that might be applied topically to reduce inflammation, but it's also available as injections, tablets, just about every dermatological dosage form as well. You get it in gels, creams, you name it. And hydrocortisone works not just as an anti-itch cream, but it's a steroid. So it's also very useful in treating inflammation or inflammatory disorders as well. So you can use hydrocortisone on burns, swelling, itching, muscle aches, redness, joint pain. This is sort of a fixture of any medicine cabinet in America. It's also quite useful for arthritis pain as well. If you have a rheumatic flare or arthritis related inflammation, it's very good to put on joints, and it can definitely reduce some of that inflammation through its steroid effect. Now, we're going to focus on side effects for topical formulations only. Those main side effects would be irritation, potential for blistering, as well as if you're sensitive to hydrocortisone. There's a potential as well for a lightening of normal skin color, otherwise known as hypopigmentation, and the thinning or scaling of skin. So normally you don't want to use hydrocortisone for a really extended period of time. And if you do, you might want to consult a doctor about potentially using some other agent. However, hydrocortisone, if there's an acute injury, say like a sprain or a swelling or a burn, it can be extremely, extremely useful. Those adverse effects that I just said normally happen after long-term chronic use. Next, we have diphenhydramine, much more commonly known as Benadryl. And that can be a topical, but also an oral product, and it works as an antihistamine. Now, you guys have probably heard about antihistamines before. Basically, what they do is they reduce the effect of histamine on capillaries, which are just your small vessels in the skin that connect your veins to your arteries. By reducing the effect of histamine on those capillaries, it reduces the allergic reaction symptoms like itchiness and swelling. So antihistamines are excellent, especially for things that make you itchy and swell up, like bug bites. Benadryl cream, I know I use it all the time. I'm sensitive to mosquito bites, so whenever I get a mosquito bite, I pop on that Benadryl cream and it puts down the inflammation. It's great for bug bites, allergic rashes, or hives. Now, the big caveat is, like with any other topical that also comes as an oral dosage form, you do not want to use the topical cream while taking the oral diphenhydramine. So if you're taking oral Benadryl as well, say for allergies or for sleep or something like that, you do not want to use it with the topical form because that's too much Benadryl in your system at once. Now, side effects. The one good thing about the topical dosage form, because it skips all of that, what we call first pass metabolism. It skips being metabolized in the stomach and the body and the GI tract where it can be absorbed throughout. So it's not a systemic medication, but rather a localized medication. Drowsiness is not as common with the topical dosage form for that reason. It's very common when taken orally, so much so that you have a warning when you take Benadryl that you probably shouldn't be, you might want to have caution operating a motor vehicle, or you might want to take it in the evening. It is certainly not as common with that topical dosage form. Photosensitivity or an increased risk for sunburn is also possible when taking a topical Benadryl, as well as you want to avoid open wounds or cuts. So if you have swelling or something from a bug bite, that's fine, but you generally want to avoid using Benadryl on anything that is maybe actively bleeding or a cut. That's when you would want to use potentially a Neosporin or some sort of disinfectant before you put down any sort of anti-inflammatory cream, an antihistamine like Benadryl. Next, we have Adapalene or Differin. And Differin is just a derivative of vitamin A, which is also known as a retinoid drug. And that has an anti-inflammatory effect that treats acne. So acne, as I'm sure you're aware, are those pimples that you can get on your skin. Now, I should say Adapalene, it controls acne and it does not cure it. And the other caveat is it takes quite a bit to work. So you have to use it every day, but it may take up to 6 to 8 weeks to see a profound effect. Now, it's available both as prescription and over the counter, and it comes as a gel, cream, or liquid applied to the skin with an applicator for medicated wipes as well. The over the counter is just a gel, and it's at a lower concentration. So there is a prescription Adapalene as well as a over the counter Adapalene that is just slightly lower in concentration. Now, considerations with retinoid drugs specifically, you have to avoid or stop it if pregnant. They have a very high chance of producing birth defects. So if a woman is pregnant or planning to become pregnant, this is not the way to treat acne. And as well, it could be potentially irritating if you were to touch your eyes, nose, or mouth. So you want to be careful and avoid that. Now, side effects include fairly common photosensitivity. So you should be advised to wear sunscreen while taking Differin, as well as a burning or stinging itchiness feeling, as well as potential for skin dryness. Now, if Differin doesn't do it, we have Isotretinoin or Accutane. You may have heard of Accutane as well. It's an oral retinoid drug. Now, remember, this is an oral, not a topical, and it's used to treat severe acne, usually when other medications do not work. Now, the reason why it's prescription and it's oral and it's very highly regulated is it's what's called a REMS drug. So that requires special monitoring for continued use. So everyone who's using this drug specifically, firstly, it can only be prescribed by a dermatologist if the patient agrees to follow up. The patient has to register with the FDA into a REMS program. In this case, it's the Isotretinoin program, and it's called iPledge. They have to sign forms stating that they accept the risk of taking this drug. And why do they do that? It's because it's teratogenic. It has been proven to cause birth defects, and it is very, very unsafe in pregnancy. It can cause these serious birth defects and potentially miscarriages as well. So it's very, very bad for pregnant women. However, if a woman is of childbearing age and she's able to follow up with the doctor with this REMS program, and they follow up, I believe it's every month, they have to take a pregnancy test as well every month to ensure that. You can see the results right here. They're pretty incredible. This woman would have had treatment-resistant acne, and look at her just probably a few months after starting to use isotretinoin. It's really life-changing for some of these people, and it works extremely well. That being said, it has some very serious side effects. So aside from the teratogenicity, aside from that propensity to cause birth defects, it can also cause bone or joint pain. It can cause inflammation of the lips or eye, including burning or redness. So it's very, very important to look out for that. It also has an increased chance of nosebleeds and skin infection or rash. But the main thing to take away for isotretinoin is it can potentially cause birth defects, and people have to register with that REMS program with the FDA in order to use it. So that just about covers dermatological drugs. As always, if you have any questions, feel free to contact me. Thank you.